physician's pocket record.
Physician's pocket record?
And he's got the list of visits, for example,
Does he?
and what he was there for and what he charged.
Ah, that's interesting.
Yeah.
And this was probably a mining town because it's with all your mining stuff.
Right.
Yeah, very interesting. What else?
It's got the doctor's name on it.
What about some of these things? Are any of these medically related? Because it says mining medicine. I don't know if that...
Yes, but this is strictly mining, but there's medical records and stuff.
Okay.
The doctors, what I just showed you, for example.
All right. Well, that's fine. That's fine. See, these are ledgers, medical students' notebooks, doctors' and pharmaceutical notebooks.
Well, I know what you
And here's at least some of the collection of this type of material that Dr. Shikes has. Just to give you an idea.
Colorado.
A souvenir plate, from a sanitarium.
The Union Printers Home, the printers had
All related to tuberculosis.
all related to tuberculosis.
And you have other material that's not even here.
Oh, yes.
Okay.
Yeah. This is
Okay.
a selection of picture postcards of the Woodmen of America Sanitarium. That was a big union in those days.
Yeah.
This
This is the Agnes Memorial Sanitarium in
Right.
Denver. Okay.
right. It's
Again,
kind of sloppy.
this is
But
part of a
it's
collection.
of letters, fever charts, and so on. This is from a doctor. These all relate to the same two girls, sisters,
Uh-huh.
who were sent here to the Nordrak Ranch, which was a sanitarium outside of Colorado Springs,
Mm-hmm.
which is now the University of Colorado, a branch of the University of Colorado. And your dear sir, your two daughters arrived at Nordrak Ranch in fine condition, etc., etc.
Yeah.
So they were sent here from California for the Nordrak Ranch treatment for tuberculosis. These are the huts that people lived in. And the two girls lived in one of these huts, and these are modeled on the Indian teepee.
I see.
And the idea was that there would be a fire going inside, and there would be a flue type of situation, and there would be a small crack allowing air to come into what was called a tent, but it's actually made of wood. It would go in and up and out through a little chimney at the top. And so the air would circulate continuously, but it would become warm because they would have a fire going on the inside. And that's how it was treated. So this is a little hill outside of Colorado Springs. And here they're telling how they were visited by a donkey one day who decided to try to get in their tent. This is one of the sisters. There's their temperature chart and pulse rate. And here's a letter to their father. These are dated early 1900s. The shortest day of the year, etc., etc. Oh, there's the drawing of a donkey coming up to their tent and trying to get in. And so it's kind of a fun sort of admission to medical school.
This is Shikes' collection of tickets to medical school lectures.
That's right.
That's his part of his collection anyway.
Yes.
Because some of these tickets elsewhere too.
And a number of these schools don't exist anymore.
Yes.
And here's, I think one of these is Harvard.
Harvard still exists, Bob, I think.
Oh, well, let me pick another one. These fly by
This
night.
is what? Show me the Geneva. Where's
The
the?
Geneva Medical College in upstate New York.
Uh-huh. And what about that? That's the first.
Well, just that's what it is. It was,
The
and
first. The first woman graduate.
well, no, I'm not sure.
Oh, okay.
Check on that. This box is open, okay? This is
Yes.
the top of the box, this is the bottom. And it's a salesman's kit,
Oh.
and with the prices on them. of medical instruments.
Oh my goodness. Show me one of the prices.
Okay.
How much?
Let's see. Let me find it. I don't know if I can do this. This is $24, whatever it is.
Whoa.
Yeah, they were expensive.
Pricey even for those days.
Yes. Well,
oh
yes,
my goodness.
Very pricey.
Okay.
And these are nurses' caps.
Uh-huh.
And I remember what these things were. Various medical tools, suturing sets.
Mm-hmm.
Oh, this is a set of various type. This is for the salesman. Various sizes of suturing
Yeah, I see.
needles,
Yeah,
and
suturing
it's
needles.
like a book.
Mm-hmm.
You open it up. Here's Bellevue, NYU Bellevue.
Our alma mater. Yay. Okay. All right.
Centrifuge.
This is a hand. You mean you crank it up?
You turn this,
Yes.
and these go spinning around.
Wow.
There are two of them, the test tubes,
Uh-huh.
with whatever it is you want to spin around
Okay.
as fast as you can do it. And then blood counters and the differentials, the lab manual of the Mass General Hospital,
Mm-hmm.
an early example. I don't know what's in there. More stuff. I mean, a lot of this is much more interesting when I'm making it. These have to do with practice of medicine in general. These are doctor's bags, stethoscopes, and then percussion hammers, and so on. These are the roll things. Did you ever use that?
Oh, yes, sure.
Okay.
To test for sensory perception,
Exactly.
for pain perception.
Right.
Yeah.
And,
Also to torture the patients.
well, that's an added bonus. Then this is a drawers of medical items and medals of one kind or another. And this is this is railroad medicine. These all have to do with railroad medicine. Was a big deal because there were so many railroad accidents,
Sure.
and so I have a whole area devoted to railroad medicine.
Okay. Here's the Denver, Leadville, and Gunnison Railway Company.
Yeah, but why is it there? Because it's
Well, railway medicine.
there's something medical there, more specific.
Yes.
And look at these tiny little vials. A lot of these are homeopathic medicines of one kind or another, especially these tiny ones. These are vials. And these are kits that the doctor would have in his bag of medicines whose names you would recognize and some not. This is an autopsy kit. Watch yourself. And what else? Microscope slides, labeled, all kinds of things. Stains. For here's a primitive microscope.
When do you think that? Where do you think that dates to?
Which one? Was the microscope?
That one and the one that's to the left of it, the larger one.
Oh, this?
Yeah.
Oh, this is more recent. This would be probably, this could be as late as 1930.
What about the other with the
That-
single tube?
That's
like it?
probably earlier.
Okay.
The doctor could put that in his bag. And then I've got slides, quite a few slides.
These are pathological and histological slides?
Right.
Yeah, okay.
And the diagnoses on them.
All right.
And the stains, the various stains, gentian this, and carbolfuchsin.
And then above that is material. You wrote the book about the history of the Colorado Medical Center. And I guess
Right.
this is some of your sources right here, Dr. Bancroft.
Yeah, these are just prominent doctors of the 19th century in Colorado.
Yes.
And Dr. Elsner.
Dr. Elsner, yes.
He was a Jewish doctor.
Yes.
A pioneer doctor. On one shelf, 2 shelves, 3 shelves
Yes.
are all patent medicines.
These are all patent medicines. Do you think any of them actually worked?
Maybe, but probably not. This is pituitary extract, for example.
Uh-huh.
And elixir of this and elixir of that.
I see, yeah.
Powder for that. Here's a set of scales
Uh-huh.
to weigh the stuff out. Smith Brothers cough drops.
Huh?
Yeah, I'm just telling you what I can see. So.
Okay. Yeah, well, these are all different patents.
Darcy's Invalid Stout, which was a beer. When Prohibition came in, they got around Prohibition.
And here's Sandeman's Port, which is still in business.
Right,
Yes.
right.
In fact, I think that's one of your favorite ports,
That's
if I
right.
remember correctly.
You're absolutely right. And then
Okay.
these are all medicines of one kind or another. This is for getting rid of, well, it's an antidote for mosquitoes. Here's the Sam Katz oxygen treatment for catarrh.
All right.
So, Mr. Katz.
And on the shelf below that?
Well, let me just, because
Okay.
there's a lot of really interesting stuff here, but that's all right, I can keep going. Okay, it's the Sam Katz oxygen treatment for catarrh.
The Sam Katz oxygen treatment. Okay, got it.
For catarrh.
Yes.
And here's more of them. And just, I could stop. This is a very early example of sulfa used in the 1930s.
Sulfanilamide, that was, if I remember, was the first sulfa preparation.
Yes, and it was in
Yes.
the 1930s.
Yes.
And somewhere there's also penicillin and early, let's see, it'll tell you about some of these things on the labels of these. Some of them are even used today. These are cigarettes that, like Blosser's cigarettes, they're medical cigarettes.
They're supposed to have some good medical effect?
That's correct.
Okay.